Welcome to the Beauty Scientists with Dr. Kristy Hamilton and Dr. Roy Kim. Real beauty without the hype.
So rhinoplasty comes from the term rhino, meaning nose, and plasty, meaning to shape or to mold. So we're going to literally be discussing different ways to shape or mold the nose, both surgically and non-surgically. And it's one of the older operations in plastic surgery. And what I love about rhinoplasty surgery is that it covers both cosmetic as well as functional components. So meaning the breathing aspect of the nose. So it's not only beauty, it also has to work well. And so we're going to discuss what rhinoplasty is, what it looks like in consultation and how we analyze the nose, surgery itself and recovery, and all the considerations you should be thinking about if you're pursuing this operation sometime in the future. So Dr. Kim, what does a typical rhinoplasty look for you? What are the different techniques that you might use? And can you go over just on a basic level, just surgical versus non-surgical, what that might look like and who might benefit from one versus the other?
I think most patients really think of either size or shape or both. So to be a candidate for non-surgical rhinoplasty, it is difficult to make a large nose a lot smaller. We can actually mask it or camouflage it and make it look a little smoother. And we can affect the shape non-surgically, but maybe not that much, not as much as surgery. So that's what really patients think about, as well as sometimes patients have a hard time noticing their profile. In other words, they know that the bump of their nose or their overall profile or their chin, nose, and forehead profile bothers them, but they can really only see that if someone takes a photo of the side of their head. So it's important to educate patients on looking at the front of the face, an angled view of the face, but something that's sort of impossible for a human being to look at the side of their face. And that's how I really approach how patients think about their nose, holistically look at it in the middle of their face or not, and we go from there.
So I agree. And the way that I broach the topics of surgical versus non-surgical with my patients is the non-surgical, you really can get a refinement on the nose that you already have. And specifically, I think there's three components of it. I was like, if you have a little bump, a little one, you can camouflage that. If your nose is slightly downward pointing, you can camouflage that. And then if you want a little bit more tip refinement, you can create that. But at the end of the day, we can't transform your nose non-surgically, but we can make it more pleasing and maybe more harmonious with the rest of your face. If we truly need a transformation, big hump, we really want to make it significantly smaller at the tip, for example, then we really ought to consider surgical approaches. And that for me is performed under general anesthesia. I mainly do open rhinoplasty, which means a little incision here in the center of the nose. This part's called the columella. Unless I'm doing a more subtle refinement, then you can do it closed with only incisions on the inside of the nose. And those are the basic components. When we're doing surgical rhinoplasty, we of course want to consider the cosmetic elements, whether the most important components to the patient, whether it's like shaving down the bridge, narrowing the nose, creating a smaller lifted tip, maybe narrowing the nostrils, and also consider, do they have a deviated septum? Or do they have airway issues? We want to make sure that the nose is both beautiful and also functions for the patient.
Thank you for joining us on The Beauty Scientists. Be sure to visit thebeautyscientists.com and learn more about modern beauty and connect with Dr. Hamilton and Dr. Kim.